Located at the heart of Dakar, the commune of Gueule-Tapée-Fass-Colobane is an area of high human concentration where almost all the languages in Senegal are spoken. A pocket of poverty and unemployment right in the middle of the wealthy neighborhoods, the commune is characterized by unfavorable socio-economic and medical indicators. From its indicators, Fass is like a mini Senegal or mini Africa. In this commune, 3 people out of 4 are under 35. With a fertility index of 4 children on average per woman, the demographic growth is close to the national level at 2.7%. The contribution of early birth in this fertility rate is important. 43 births for 1,000 girls aged 15 to 19, compared with 10 births for 1,000 girls aged 15 to 19 in Quebec, for example.
On est devenu depuis quelque temps des grandes vedettes.
For a while now, we have become like big stars because everyone comes to Fass-Colobane Gueule-Tapée to talk about the Demographic Dividend project. In relation to the UNFPA, we have decided to speed things up and set up an emerging Fass plan. It is based on 2 pillars, demography and economic development. We need to be able to link those 2 things together so that we can develop all while including our demographic development, if I may express things so. So Fass is like a mini Senegal. 60% of the population is under 35, so it's a young population. Many of them are unemployed, yet paradoxically we have in our commune an area where you can access preschool, primary school and high school without ever taking a bus, because we are the best supplied commune in terms of education. There is a gap in terms of employment, and that is a big problem for us as it can lead to drug use, prostitution and crime. So the objective is to reduce all of this, to help youth get employment, help empower women, and we want to rely on this demographic dividend project in relation to UNFPA.
Nous voulons nous appuyer sur ce fameux projet de dividende démographique en relation avec le FINIAP.
Health is one of the essential pillars when capturing the demographic dividend. It's a major concern for the district. With a population of approximately 100,000 inhabitants, Gueule-Tapée-Fass-Colobane has 8 health facilities, 3 health posts, 3 health centers and 2 hospitals that are inadequately equipped, with an insufficiency in human and financial resources for their operation. In the Fass district in particular, where population borders 30,000 inhabitants, there used to be 1 health station, which did not even have a gynecology table nor a maternity ward. Amadou Sow and Olimata Diouf are respectively the head nurse of the health center and a midwife in Fass. We meet them in the neighborhood, a stone's throw from the ruins of the only health stations where they still worked a few weeks ago.
Nos difficultés, en fait, c'était surtout par rapport à la santé de la...
Our challenges are related to maternal and child health. We didn't have a maternity ward here. Having a maternity ward could enable us to help with delivery. That was the element that had held us up in relation to the PV indicators, because when the midwife received the women who were pregnant, she did the antenatal consultation, and the afternatal consultation, the woman would deliver in other facilities, and that created a hold up in terms of vaccination.
Et ça a créé
because when the women gave birth in another facility, they would have to have the vaccinations in that new structure. So the whole population of Fass, or the majority at least, would go and do the vaccination in different facilities.
En majeure partie, faisaient leur vaccination dans les autres structures.
Il faut reconnaître que quand même mon infirmier chef de poste a vraiment raison.
We must admit that the center head nurse is right in what he said, especially in relation to the consultation that we used to do. I can mention them. There were the antenatal consultations, the postnatal consultations, the gynecology consultations, family planning, and other consultations. When I say other consultations, I mean women who come here regularly and because of their health need a certain amount of monitoring. Because even if we didn't have proper hospital rooms, the emergency of these situations called for hospitalization, or at least the need that we keep an eye on them here, even if it would just be for 12 hours before we could let them go. But we must say that the great challenge that we had was related to the postpartum period. That is the phase after the antenatal consultation and the delivery. Most of the times, during the group discussions we had in the neighborhood or in the health centers, it was the women who complained about that before the midwife could even give her comments. The health station was demolished about 2 months ago in order to be rebuilt within the framework of the Emerging Fast project. This project, launched in February 2018 by the UNFPA, the United Nations Fund for Populations, aims at improving the human capital, the economic opportunities, and the local governorship in order to accelerate the demographic transition and to benefit from the demographic dividend.
Ce que nous attendons, c'est que le poste soit au complet.
What we expect is that the center should be completed soon. When we get a maternity ward, it will enable the populations of FAS to have all the services in the one center. It will enable us to reduce the number of cases that we lose sight of. It will also enable us to increase our indicators in terms of PV and family planning. And I think that the center setup was timely because it will enable us to provide a good follow-up service to the women of age of procreating.
Un bon suivi des femmes en âge de procréer.
Avec l'appui de la mairie, nous avons eu à remarquer qu'il y a...
With the support of the town hall, we got to notice that there was an increase in all the indicators. That is the reason why, with the ICP, who is my witness, we have fought to have access to a facility while our center is being built so that our indicators don't drop. The discussion sessions that we had in all the neighborhoods of FAS were a battle that we fought, as were the advanced strategies that we did in the context of family planning, the antenatal consultations, the screening of the pathologies related to women. If these indicators have increased, it is because there were evolutions that we noticed. But we remain optimistic because for the next construction, there will be a maternity ward with delivery rooms and hospital rooms. We are satisfied and look forward to the construction being finished.
Des salles d'hospitalisation. Nous en sommes vraiment satisfaits pour que cette construction soit menée à terme.
From an economic point of view, the rate of high youth unemployment in FAS masks the prevalence of professional activities at very low wages, and most of the youth are devoted to small trades. This precarious economic situation feeds the insecurity, with, as a consequence, juvenile delinquency, drug use and prostitution.
Le dividende démographique étant une croissance économique potentielle.
The demographic dividend is a potential demographic growth linked to the age of pyramid of the population. In other words, it's about seeing how to help the growth of the active population compared to the inactive one. I think that it is a challenge of the demographic dividend, and the UNFPA found us working in that perspective, and choosing FAS is not incidental. The indicators sufficiently showed that it's a district that adequately represents Senegal on a smaller scale.
C'est en fait une commune qui représente ou qui a une représentation du Sénégal en miniature.
It means that the challenges in relation to demography, in relation to social demography, etc., what happens here is what happens in Senegal as a whole. And we think that the targeting FAS as a pilot is like seeing all of Senegal. So as a district, we need to be successful in this project.
C'est pourquoi nous sommes obligés, j'ai dit, c'est une obligation pour la commune de réussir ce projet.
If you look at things from a demographic level, and that is what is fundamental in FAS Gultape Koloban, the demographic dependence ratio is around 39%, whereas in Senegal it's at 80%. And usually you say that a population that has a dependence demographic close to 50% is a population that has a demographic opportunity and a demographic bonus. Now it's about capitalizing this demographic bonus to move towards the demographic dividend, because for FAS we have a demographic dependence at 39%, which means that at the moment FAS presents a favorable situation to develop economically and globally.
It is because of these indicators that the choice was made for Gultape FAS Koloban to launch this pilot initiative of operationalizing the demographic dividend, the FAS Émergent project.
C'est moi qui l'ai appelé FAS Émergent.
I had the idea to think about this with the UNFPA, who suggested it to me. I thought it's a bit like this is a little emerging Senegal. First of all, FAS is like a little mini Senegal, and then we see that health is involved, education is involved, the training of youth and employment is like a little PSE, which is the emerging Senegal plan. So I called the emerging FAS plan. What I expect is that the youth be trained, that employment be created, that the healthcare should be provided. What I expect is that the living conditions should be improved. So it's a whole, and even though we don't have the means, we do think about it. But now we need to find the means to achieve it. So I hope that in 1 year, 2 years, the project will spread out, and that throughout Africa, people will copy the FAS emerging plan. I believe in that.
J'y crois profondément.
Le principal problème en ce qui concerne l'emploi et l'autonomisation.
The main problem concerning unemployment and the empowerment of women and youth is the problem of funding and access to credit. So we are setting up a financial mechanism to support youth in their project and in their blanket project. So for this to happen, we are setting up the area of FAS Gultape Koloban, a mechanism of financial animators. Because, as you know, in general, the district are generally political arrangements, so the economic aspect is not always developed. What we want to set up in this district is a network of economic animators so that they can carry the economic dimension of the district. So once these animators are trained and have their skills strengthened, they will be sent out in the communes of FAS Gultape and Koloban to select the main cable projects. Then these projects will be financed by this financial mechanism that we will set up.
The project targets women and youth, and in particular the young girls. It also takes into account the needs of children, men, health professionals, local representatives, members of the civil society, traditional and religious leaders. This afternoon, in the courtyard of the Gultape FAS Koloban Town Hall, the district's Women's Collective holds a meeting on the FAS Emergent project. This collective is both a beneficiary and an actor of the project. The members have already been trained on reproductive health and will also benefit from the empowerment module. Moreover, they will have to coordinate all the activities related to women. We welcome this project with an open heart because this project found us when we were trying to make do with what we had. The mayor of this district found us here in our district and asked us about the project. So the project came as a support to women and health and adolescents. He found us working on this, and he came here to help us do good work with us. We are very happy with what he did. He came and had a discussion group and did social mobilization to know about the population and what the projects can do with women and organizations and imams and neighborhood chiefs, and all that the population has done concerning the activities of the project related to the demographic dividend. We've been waiting for this project with a lot of hope. It's a place of hope for the women of FAS in particular. Because we, the women, we face problems related to training. We try to make do with the small means that we have. But as we await this project, we are enthusiastic. At the Fas Gueule-Tapée Koloban district, women have gotten together in associations in a framework of consultation, and since 2009 we follow out activities. We have training everywhere. We have training in all the fields, in poultry farming, in dyeing, everything. But we have never had the means to actually fully put into practice our skills. So that is why we warmly welcome this project, because it helps us to be able to sort ourselves out, because empowerment has been made possible with this project.
Ça va changer beaucoup de choses. Parce qu'on n'avait pas, enfin, on avait un poste de santé qui n'était pas.
It will change many things, because we used to have a healthcare center that was not very well equipped. There was only one midwife and some nurses. We weren't really at ease here, and it was too small. The Emerging Fast project has brought us an equipped healthcare center with a delivery room. The delivery room will be equipped. We will be really blessed in this field. Because here, the health of mothers and children is a priority. If a woman is not well, she can't procreate. Even if she does procreate, the child will not be in good health. Additionally, 15 youth have been trained within the framework of the project to animate the Town Hall's Adolescent Advice Office. This afternoon, we attend one of the youth group discussions. Here, one can speak freely about early pregnancies, early marriages, gender-based violence, and contraceptives. Youth and teenagers are given advice and directions on these topics.
Notre quotidien, c'est de sensibiliser les jeunes, les orienter vers la bonne information.
Our everyday activity is to sensitize youth and orient them to good information so that they have all the information related to reproductive health for adolescents and youth. That is our day-to-day activity. This is done at the office. Now, out of the office, we do home visits, we do group discussions, and even act our small plays to sensitize the youth and give them good information so that we can close the debate on early pregnancy and eradicate this plague completely in the commune of Fas Gueule-Tapée Koloban. By 2030, inshallah, we will no longer hear that expression. That is what we are working on. We are a dynamic team and we are getting results little by little, and I think that by 2020 we will be able to present extraordinary results.
Nous avons un combat à mener, à faire passer ce message aux
We have a battle we need to fight, and that is to send this message to the religious and traditional authorities so that we can manage to launch this project. And we are getting there little by little because we have empowered women, we have empowered youth, and they understand what we are doing. Because if we do it any quicker, that will also be difficult. So we are fighting for fast to emerge, all while considering this factor of demography.
On ne peut pas parler de capital humain sans pour autant parler de certaines composantes.
We can't talk about human capital without talking about certain components. I mean by that the reproductive health of women and girls, gender-based violence, family planning, and harmful practices. These are things that we can base ourselves in order to learn towards capturing the demographic dividend. This is where the intervention of traditional communicators becomes important.
Et m'cotant à forte tradition orale, on a notre communauté, notre action au sein de cette communauté nous permet.
We rely on a strong oral tradition, and our action in this community enables us to make the populations understand that to reach a certain level, you need to first master the reproductive health of women, that is to enable women to give birth without dying on it.
Sans en périr, dans un premier temps. Dans un deuxième temps,
secondly, it's about protecting girls from harmful practices, that is to say unwanted pregnancies, early pregnancies, and early marriages too. We are learning towards that, and it's an aspect of the demographic dividend.
Du dividende démographique.
300 youth of the districts of Gueule-Tapée and Fas Koloban have been mobilized around questions related to child marriage, early pregnancies, information for young girls about youth and adolescent reproductive health services, and on quality health care through talks organized by AFRIAN, the African Youth and Adolescent Network on Population and Development.
En ce qui concerne le projet de FAS, on nous a impliqués dans ce projet.
As for the FAS project, we got involved at the implementation stage of the project, and it is this project and we asked to get involved as peer educators and youth and animators. We were asked to strengthen the skills of youth in this field, and as animators we need to train or strengthen the youth who are in this sector.
De renforcer la capacité des jeunes qui se trouvent dans ce secteur.
Déjà, on a échangé et partagé les informations.
We shared and exchanged information on reproductive health and family planning for young girls in early marriages and the girls who are involved in sexual activities early, and all this without offending anyone. We have also promoted the strengthening of skills in the framework of the fight against STDs, HIV/AIDS, and early marriage and unwanted pregnancies, and many other topics. And also we've strengthened the capacity of many other girls through sensitizing and concrete actions led by girls and for girls.
This is a project that can help us strengthen the development of the district. It was the UNFPA who initiated this project, selecting FAS as a target. I think this project will develop in other territories of the country, so it's a bonus for us to successfully fight our battle in the framework of the skill strengthening in the development of the commune.
In relation to youth employment, the UNIDO, the United Nations for Industrial Development Organization, intervenes as a partner for the promotion of the creation of jobs for the youth and women of FAS. In Dakar, we meet the UNIDO representative for Senegal, Cape Verde, Gambia, Guinea-Bissau and Mauritania.
La partie, je dirais, économique va démarrer.
The economic aspect of the project will start with the supply of all these little entrepreneurs who are in a state of survival, so to speak, with training, with funding and with long-learned support that will enable them to develop and to get organized, so that instead of being in a state of survival individually, they can get together and develop purchase centers, because often they approach suppliers, and if there are 100 or some thousands who approach the supply together, they can better negotiate the prices. They can also be in a better position to negotiate with the authorities or to approach banking institutions as a group and to have the possibility to provide mutual security deposits. So it's about restructuring, training and funding. That is what we are going to be busy with.
And what kind of employment are we talking about, and in what sector?
Alors il y a plusieurs secteurs, vous avez beaucoup de secteurs si vous vous promenez dans la Médina.
So there are many sectors. If you walk around Medina, for example, you will see many shops. There are carpenters, people who do woodwork. There are people who make shoes, who transform leather. That's in the neighborhoods in town. But if you go on a coast side, then you will find many women who work in the fishing industry and also the creative industries with the Soumbédioune market, which is dedicated to the creation of creative arts and craft objects. So for all these professions, we can help them by forming groups and setting up associations, cooperatives and clusters as they are called today. For example, a cluster of carpenters, a cluster of those who work in fishing processing, and together as group it's much easier to share equipment and to access certain services. Because it's difficult to help each little entrepreneur, but if they are group, we can provide training. They can have access to credit, we can support them, help them to be structured and enable them to have a more significant development.
On peut les accompagner, les structurer et donc leur permettre d'avoir un développement plus important.
Among the UNFPA partners are the traditional communicators. The regional network of traditional communicators for Central and Western Africa helps to popularize messages in view of boosting the indicators relating to the 3 zeros, meaning zero maternal death, zero unsatisfied need in family planning, and zero gender-based violence by 2030.
Avec le partenariat qu'on a tissé avec l'UNCDF, qui est un
We have tied a partnership with the UNCDF, which is the United Nations Capital Development Fund. because in the district, in particular for governance, the main problem is the mobilization of own resources. So we are currently doing a financial and fiscal diagnostic of the district to identify the bottlenecks, the obstacles, and then to set up strategies that will enable the commune to increase its tax revenue. So we find ourselves in this momentum with the UNCDC, and also to see how to digitalize the mobilization of resources in the commune of Fass Gueule-Tapée Colobane. We are in this project for the 2019 year. With the UNICEF as well, we hope to implement activities, namely to set up a municipal children's council, a place for youth to go and meet and discuss their problems. We will also train the local representatives as we did for gender-sensitive participatory budgets. However, this time we will do it for the children-sensitive participatory budget.
Fass Emergent is a pilot scheme which stresses the investment in health, education, entrepreneurship, governorship, and the promotion of grassroots development. It should extend to other African communities which are confronted with these same realities.